Christianakis. I'm an assistant professor of clinical medicine at USC. I've found great utility in using the AVICE SLE plus connective tissue disease testing. It helps me rule in and rule out lupus first and foremost, but it does help me differentiate between other connective tissue diseases, and it is a better testing methodology compared to the current standard. My patient is a 59-year-old Caucasian female. She was referred by her primary care physician, as well as her husband, who's a radiologist. She came in with a positive ANA and an indeterminate double-stranded DNA from an outside lab. In addition to these tests, she complains of photosensitivity, myalgias, arthralgias, and she'd complain of color changes in her hands in cold weather. I was concerned of this Raynaud's type phenomenon and these positive ANA tests and impending connective tissue disease, particularly lupus. The results of the AVICE 2.0 antibodies were non-suggestive of lupus with an index of -1.1. The pertinent antibodies that were positive were anti-MCV antibodies, anti-TPO antibodies, an ANA pattern of 1 to 1280 with centromere, and the BC4D positivity. So at that time, the patient fit a criteria of undifferentiated connective tissue disease, along with a diagnosis of Hashimoto's thyroiditis. She had symptoms that presented classically for impending connective tissue disease. She's currently being treated with thyroid hormone replacement, which is treating her Hashimoto's thyroiditis. And in the meantime, we're assessing her periodically for development of connective tissue disease.